With few exceptions, such as in Afghanistan, the order represents the most dramatic attempt yet to slow the spread of COVID-19 among the Defense Department. Defense Secretary Mark Esper said Wednesday he would cease any major movements of U.S. forces around the globe, the most dramatic step the Pentagon has yet taken to address the growing concern of the coronavirus pandemic. In an interview with Reuters, Esper said the order applied to all active duty service members, as well as civilian employees and their families. Among the few exceptions will be troops withdrawing from Afghanistan as part of a peace deal the U.S. signed with the Taliban earlier this year. The purpose is to make sure that we're not bringing the virus back home, infecting others, that we're not spreading it around the military, Esper told Reuters. It was not clear whether the move applies only to new orders for service members to deploy abroad or any international travel by active duty troops for any reason, such as personal travel. The Pentagon did not immediately respond to a request for clarification. The order comes as the Defense Department continues to struggle with containing the virus, which causes a disease known as COVID-19 both within its own ranks and ensuring that any public health response it helps orchestrate doesn't in turn cause further spread. Esper has faced criticism for not acting sooner to prepare the Defense Department to protect its own forces and to assist in the federal response. The department Wednesday morning reported a jump of 53 new cases of the coronavirus among the active duty force, bringing the total to 227 known cases. Another 81 civilians have contracted the virus, as well as 67 military dependents and 40 contractors, one of whom died from the disease in a hospital last weekend, the first known death from the virus within the department. The U.S. headquarters overseeing operations in Afghanistan reported Tuesday that 4 service members who recently arrived in the country had tested positive for the virus and were placed into a separate quarantine. Earlier this week, Navy Times reported the Sea Service had begun sending medical teams to test for the coronavirus among its deployed ships. A Navy official told reporters on Tuesday that at least 3 sailors on the USS Theodore Roosevelt aircraft carrier currently operating in the Pacific had contracted the virus, adding they had been flown off the ship and that all others they encountered had been placed in quarantine. That incident raises concern about the potential spread of the virus in a closed environment like a ship, particularly following reports of massive outbreaks among passengers aboard civilian cruises in recent weeks, such as the Diamond Princess cruise ship. Broad attention has focused on the Pentagon for how it might contribute to the federal response to the spread of the virus, both in distributing stockpiles or manufacturing health care equipment such as masks or ventilators that overworked hospitals in New York, California, Washington State and elsewhere may need. Ellen Lord, the Undersecretary of Defense for Acquisition and Sustainment, told reporters on Wednesday that while individual components of the military have been working to make up for these shortfalls, department-wide coordination only began on Friday. Earlier this week, Esper and the military's top officer, Army General Mark Milley, told defense employees in a virtual town hall to expect the additional health restrictions to remain in place until at least the summer, if not longer. Air Force Brigadier General Paul Friedrichs, the surgeon for the Pentagon's top uniformed military office, advised Wednesday not to focus on when the threat posed by the virus may end but what can be done to mitigate it now. "I don't think there's a great deal of value in speculating about a particular date," Friedrichs told reporters at the Pentagon. "Worry about today.